Stages of baldness part 2. Hello everyone, welcome back to our series on the stages of male pattern baldness. In part 1, we covered stages 1, 2 and 3. What they look like and the different treatment and solution available for all those early stages. Today in part 2, we are moving on to stage 4 of male pattern baldness. We'll talk about what a stage 4 typically looks like and the treatment options you have if you are currently at this stage. So let's begin. In part 1, we saw that by stage 3, the hairline at the temples begins to recede even further, gradually moving backwards. At this stage, hair loss becomes more noticeable. In stage 4, male pattern baldness becomes even more apparent. The hairline continues to recede, pushing further back, while a more visible bald spot develops on the crown, top of the head. A thin strip of hairline separates the receding hairline from the bald spots. What you are seeing in this image is grade 4 or stage 4 of male pattern baldness. Due to the conversion of testosterone into dihydrotestosterone, hair starts becoming thin. The temple and the crown area of our scalp are genetically sensitive to DHT. Therefore, in stage 4, we see more hair loss in the temple and the crown area. You can see that the hair density in the middle of his scalp has reduced. They are looking very thin, sparse. The temple area has also receded and has gone backward. Approximately 50 to 60% hair has reduced on the crown. This is called the 4th stage of male pattern baldness. Generally, medicine are not effective in stage 4. Medicines won't make any difference in the treatment of stage 4 baldness. This is my opinion. Sometimes, temporarily, they can give some results, but not permanently. And I am saying this from my experience because by the time we reach stage 4, the hair roots are completely destroyed in the particular area where the roots have been lost, which cannot be brought back by any medicine. But yes, with some advanced hair treatments like PRP, GFC, exosomes, etc., hair fall can definitely be controlled to a great extent. So that the baldness does not increase further, some new hair can also grow with these treatments, but hair transplant is an effective solution for stage 4 baldness, which I mostly recommend to my patients. Hair transplantation is done in the area where there is hair thinning or where there are no hair at all. Normally 3000 to 4000 grafts are required in stage 4 baldness. This patient came to me with a stage 4 baldness. In his case, I suggested him 3500 grafts of FUE procedure, the advanced ones. You can see that in just 6 months, the density of his hair has improved a lot. Hairline which has moved backwards also became correct and thinning on the crown also reduced. So this was part 2 of our series. We saw what is stage 4 baldness and what is the right solution for it. In the next part, we will talk about a stage 5 of male pattern baldness. So stay connected with us. If you have any questions or concerns, then you can ask in the comment section below. I will try to reply as soon as possible. See you in the next video. Thanks for watching.